Lagos State government has released guidelines for the resumption of public and private schools.
A statement issued by the Commissioner for Education, Folashade Adefisayo, says only JSS3 and SS2 students in public schools will be allowed to resume on Monday, the 21st of September. The Commissioner says the plan is to enable public schools meet COVID-19 special social distancing rules and other safety protocols and help the students prepare well for their examinations.
The Commissioner emphasized that pre-primary school classes in both public and private schools will remain closed until further announcements are made by the government. And also in Ekiti State, Governor Kayode Fayemi has ordered the reopening of primary and secondary schools on the 21st of September to put an end to months of schools closure due to the COVID-19 pandemic.
Governor Fayemi also directed that tertiary institutions in Ekiti be reopened to students from October the 2nd, subject to each institution's governing council's decision, but with very strict adherence to safety protocols. Specifically, the governor said students in SS2, JSS3 and Primary 6 are to resume on the 21st of September, while students in SS1, JSS2 and Primary 5 and 4 are to resume from September the 28th.
Students in JSS1 and Primary 1 to 3 are to resume on October 19, while pupils in kindergarten and nursery schools are expected to resume on November the 2nd, when more assurances of safety for their age bracket would have been established. Joining us now for more on COVID-19 and safety protocols is the Secretary, Nigerian Medical Association, Lagos State Branch, Dr. Ime Okun. Good morning, Dr. Okun. Nice to see you.
Good morning.
Great.
Good morning.
Great. Now, we are seeing the numbers of COVID-19 stabilizing and dwindling gradually since the last 2 weeks. Can we confidently say that we have flattened the curve at this time?
Not at all.
Okay.
We can't say we have flattened the curve. The thing is, with the testing, we are actually, the positivity rate is actually reducing. But, you know, we still cannot rest on our oars. So we can say we have flattened the curve, actually. We can't use
so
that.
at what point can we say we have flattened the curve?
Okay, so we'll continue the testing as we're doing and taking the non-pharmaceutical interventions, all our use of face masks and all that. Then we'll continue to look at the numbers. Then we can actually say when the curve is flattening. When it's flattening, it will be very obvious and we'll all see.
When you say the positivity curve is, or the positivity rate is reducing, how do you mean? Are you saying because a lot of concerns based on people not observing the protocols is out there by the government, and we're wondering, how is that possible?
Okay, so the number of positive, you know, the testing has increased. Yet the number, before, when we were doing the testing, we'll see that the number of cases were increasing. Maybe like if you do 1,000, then you find out that you have like 100 or something positive. But in this time around, we're seeing that the number of cases that we're discovering is reducing. Yes, I know people still have this doubts and disbeliefs about the testing. This is very worrisome, actually. And the thing is causing community transmission everywhere. But then this is what we have been seeing in the laboratory. Let's hope that very soon the pandemic will be controlled.
All right, now, because we are trying to logically look at the numbers and then also look on the streets where there is this frustration that, in fact, the PTF, the Presidential Task Force, Ministry of Health, and the NCDC have all said that the people are not adhering to the safety protocols. They have voiced that out so many times. Yet the numbers are gradually reducing. So how do we reconcile this?
Okay, so out there, like I said, it's really worrisome. Okay, like a friend of mine traveled to Edo recently for a burial, and she was in shock because here in Lagos, maybe because it's the epicenter, so many of us are used to using the face mask. But you know, when you go outside Lagos, you just find out that almost everybody, in fact, you feel a little, you feel embarrassed when you use the face mask because it looks as if you're the only one out there. But the number of testing, again, like I said, is actually reducing. You know, so when you look at the number of cases that, the number of tests that we are doing is actually reducing. That might be one of the reasons why we are seeing what we are seeing.
Some other persons think that perhaps we have a lot of asymptomatic persons out there, which is also generating some sort of concerns that with the community spread, we may not really know until it is full-blown, and then our systems get overstretched.
Okay, so the asymptomatic cases actually will test positive, really.
All right.
You may not be able to see the symptoms in them, but if they do the testing, so you find out a case that is asymptomatic, is capable of spreading the disease. But if that person does not actually go for testing, and you know most times people that go for testing are people that have had symptoms, so they will have a reason to want to go and find out what exactly is happening to me. Could it be COVID-19? But somebody that is apparently well, but the person is out there in the community and is spreading it. So if such people don't test, you know, it won't reflect in our results. So, and we have a lot of asymptomatic cases in Nigeria, in Africa generally.
Wow. Could there be any explanation for that?
Well, generally, I wouldn't say, should I just say we're lucky in Africa that we did the kind of strain that we're having. And that's one of the reasons why people tell you there is no COVID-19 out there. Yeah. You know, because when they look at the pictures we see from abroad, you see people on ventilators and all that. You see them moving corpses from here to the other, you know. But when they show our own isolation centers, you're not seeing
people are grooving sometimes.
So you can imagine that is why, you know, so the kind of strain that we've seen in Africa, luckily for us, it's not been that bad.
Maybe further research will reveal some of the reasons why. Because at the initial stage, when they were saying the climate in Africa or sub-Saharan Africa, you know, others said that the race or the pigmentation of our skin or something, but all of those have been debunked and said, no, this is not. But somehow, the prediction or the projection that there were going to be dead bodies dropping on the streets, that didn't come
beyond that.
Despite all of the weak or inadequate health systems that we had. Yeah.
Even at some points, it was mentioned that, okay, maybe because we've had tuberculosis, we had BCG, you know, the vaccination against BCG was sort of protective against COVID and all those postulations. So those are the kind of things that have been talked about as being protective for Africans.
Okay. Right. So we wait to see further research that would either, you know, confirm or otherwise some of these theories.
Sure. So while we wait for the research, while we wait for the vaccines, everybody keep using your face mask, wash your hands, use your hand sanitizer, and maintain the physical distances and all the pharmacological things that have been put in place by the NCDC. Right. And we'll keep staying safe.
All right.
Now, one major issue that has been of concern to the government is the issue of taking responsibility. A lot of Nigerians seem not to want to take responsibility, and there are concerns as regards to whether this is born out of ignorance or just not wanting to take responsibility. That's defiance.
Okay, so I think the problem people have is lack of trust. So they have distrust, and if you look at the people that are usually publicized as those that have been victims of COVID-19, they see it as a status thing. But like I tell people, COVID-19 is not a respecter of status. It affects everybody because they come and tell you, is it not governors that are having it? The big people are the ones having it. Have you seen a poor man? Okay, so the thing is the people that are publicized that they're seeing are supposedly the big ones. The ones that have not been publicized are many there that are dying in their, you know, in their numbers. So you see a typical man come and like tell you, where is COVID-19? Abroad, when we see on the television, you see people connected to ventilators and things like that. But in Nigeria, when they show the COVID-19 isolation centers, you see people eating, some people are even making music.
So the picture we are painting is what is the challenge here?
So we try to do what we call risk communication, and that is getting the appropriate message across to people. Yet it seems they have this lack of trust in government. They talk about the monies being, they feel that they're just using it as an avenue to get money. And I'm wondering where they are getting this impression from, you know, because COVID-19 is real. I've had people close. Maybe, you know, I think it's a problem of if it has not gotten close to you or happened to somebody very close to you, you have that doubting Thomas thingy. So that's what I think is happening.
So in that case, you're saying that we are not communicating appropriately.
We are communicating, like I said, like the rapid response team of the response, they are communicating, but people are not taking responsibility. People decide to believe what they want to, you know. So we are now trying to go through gatekeepers or influencers of the community, religious leaders, you know. By the time their religious leaders or their community leaders are the ones passing this information, maybe we'll be able to get it better to them.
But we've seen so many religious leaders come against the government, in fact, they believed a lot of, you know, conspiracy theories about COVID-19, and that has become counterproductive. Some videos went viral of some religious, very highly placed religious leaders in the past talking about calling COVID-19, you know, a weapon, you know, and
against the
you know,
church and all.
a strategy to, you know, against the blacks, you know, so many different things.
Well, I'm not very much aware of those ones because I know the Catholic Church, for instance, comes out to tell you that while you're even making your hand wash, they tell you that you're washing hands, you have to wash it 20 seconds methodically, and even tells you while you're washing your hands, while you're praying Our Father, make sure you finish praying it, and that will take you 20 seconds. So I think that is a good one that should be emulated. And that's what I expect from our leaders to pass on to their people.
All right, we'll leave the conversation here now. Dr. Imeokun, thank you for your time.
Thank you. Do have a nice day.
Thank you.
Bye-bye.
You too as well.
Thank you.